A stroke is a serious medical emergency that occurs when the blood supply to part of the brain is cut off. Imagine a vital road suddenly blocked, preventing essential supplies from reaching their destination. This is similar to what happens during a stroke, where brain cells are deprived of oxygen and nutrients, leading to potential damage. This disruption in blood flow can be caused by a blockage in a blood vessel, known as an ischemic stroke, or by a rupture in a blood vessel, termed a hemorrhagic stroke. Both types can have devastating consequences affecting a person's ability to move, speak, think, and even survive. Time is of the essence when it comes to strokes. The longer the brain is deprived of oxygen, the greater the potential for lasting damage. Recognizing the signs and symptoms and seeking immediate medical attention is crucial for improving the chances of a positive outcome. Therefore, understanding the intricacies of strokes, from their causes and types to their treatment and prevention, is paramount for everyone, not just healthcare professionals. Knowledge is power, and in the case of strokes, it can be life-saving. Strokes are broadly classified into two main types, ischemic and hemorrhagic. Understanding the difference between these types is crucial for effective treatment and management. Ischemic strokes are the most common type, accounting for about 85% of all cases. They occur when a blood clot blocks an artery supplying blood to the brain. Imagine a traffic jam in a major artery, preventing blood flow. This is similar to what happens in an ischemic stroke. Hemorrhagic strokes, on the other hand, are less common but often more serious. They occur when a blood vessel in the brain ruptures, causing bleeding into the surrounding brain tissue. This bleeding can put pressure on the brain and damage brain cells. Both types of strokes are serious and require immediate medical attention. However, the specific treatment approach may differ depending on the type of stroke. Knowing the signs and symptoms of both ischemic and hemorrhagic strokes is crucial for timely intervention. Recognizing the signs and symptoms of a stroke is crucial for timely intervention. The faster a stroke is diagnosed and treated, the better the chances of a positive outcome. Remember the acronym FAST, which stands for F, face drooping. Ask the person to smile. Does one side of their face droop? A, arm weakness. Ask the person to raise both arms. Does one arm drift downwards? S, speech difficulty. Ask the person to repeat a simple sentence. Is their speech slurred or strange? T, time to call 999. If you observe any of these signs, even if they are temporary, call emergency services immediately. Other symptoms of a stroke can include sudden numbness or weakness in the face, arm, or leg, especially on one side of the body, sudden confusion, trouble speaking or difficulty understanding speech, sudden trouble seeing in one or both eyes, sudden trouble walking, dizziness, loss of balance or coordination, and sudden severe headache with no known cause. It's important to remember that even if these symptoms disappear quickly, it's still essential to seek medical attention. These could be signs of a transient ischemic attack, TIA, also known as a mini-stroke, which is a warning sign of a potential major stroke. Section 4. Exploring the causes and risk factors, understanding the culprits. To understand how to prevent strokes, it's crucial to first understand what causes them. Strokes occur due to a disruption of blood flow to the brain, which can be caused by a variety of factors. One of the leading causes of stroke is atherosclerosis, a condition where plaque builds up inside the arteries, narrowing them and increasing the risk of clot formation. This plaque buildup is often fueled by unhealthy lifestyle choices such as smoking, poor diet, and lack of exercise. Other risk factors for stroke include high blood pressure, diabetes, high cholesterol, atrial fibrillation, a type of irregular heartbeat, and family history of stroke. Some risk factors like age and ethnicity are beyond our control. However, many others are modifiable, meaning we can take steps to reduce our risk. Section 5. Seeking timely intervention, diagnosis, treatment, and recovery. When it comes to strokes, time is brain. The faster a stroke is diagnosed and treated, the better the chances of limiting brain damage and improving outcomes. Diagnosis typically involves a combination of physical examination, neurological assessment, and imaging tests, such as CT scans or MRIs. Treatment for stroke depends on the type of stroke, its severity, and the overall health of the individual. For ischemic strokes, clot-busting medications may be administered to dissolve the clot and restore blood flow to the brain. In some cases, a minimally invasive procedure called mechanical thrombectomy may be performed to remove the clot directly. Hemorrhagic strokes, on the other hand, require different treatment approaches focused on controlling bleeding and reducing pressure on the brain. This may involve medication to lower blood pressure, surgery to repair the ruptured blood vessel, or procedures to drain the accumulated blood. Recovery from a stroke is a journey that varies greatly depending on the extent of brain damage and individual factors. It often involves a multidisciplinary approach including physical therapy, occupational therapy, speech therapy, and psychological support. Patience, perseverance, and a positive attitude are crucial during this phase.